Welcome back, everyone. Well, as you just heard from my intro with Matt, not a lot is known about sarcoma, a form of cancer. So to help build awareness for it and give you a bit of an idea of what you can do, we invited a specialist in. Dr. Matthew DiCaprio is the Director of Orthopedic Oncology for Albany Med. So welcome, Matt.
Thank you.
Nice to have you here. You're welcome. Sarcoma, you don't hear it every day, kind of rare. It is a form of cancer, correct? So give me a bit about a background on this.
Sure. Sarcoma is a very rare form of cancer. Probably makes up less than 1% of all the cancers we see in this country per year. Kind of two big categories. There's bone sarcomas that happen obviously in our bones, and there's soft tissue sarcomas that happen in the muscles, the fatty tissue, vessels, and nerves around the bones.
You know, cancer, the big C word, right? Devastating. You hear about it usually with prostate or breast cancer or something like that. How does this form of cancer manifest itself? How do you know?
Great question. That's probably one of the biggest problems because these are so rare. Nobody knows how they present. But they most typically, for a bone sarcoma, it's going to be a child that presents with several months of pain, maybe a growing mass, and frequently, because they're so uncommon, are attributed to other factors, growing pains or sprain,
sure,
or
of course, yeah.
Got hurt playing baseball or softball or something like that. So that would explain the bone sarcomas. The soft tissue sarcomas are a bit sneakier. They really are just could be slowly or rapidly enlarging mass, usually don't have any pain, so any mass that's enlarging really should be evaluated.
Oh my God, it sounds so devastating when you think about it, because if it follows suit with other cancer and other cancer treatments, the sooner you know, the sooner it can be treated and the sooner it can be cured, right?
Absolutely.
So I would imagine, I mean, tell me, part of it is catching up to it, right?
Yeah, if you can ideally get it when it's localized. Starts in the thigh, it's only in the thigh, hasn't spread to the lungs or other bones or other soft tissues. Patient survival is pretty good. It's about 70% for 5 years after their treatment. And that treatment's lengthy and it entails a lot of complicated measures and a team approach to take care of it.
Yeah, you know, before we went on air, Matt was telling me that you need a team for this because you need that expertise in a number of different areas. I believe that's got something to do with the form of treatment. There are a lot of different forms of treatment, from surgery, which I guess you specialize in, correct?
Correct.
To what else?
Well, first, probably the biggest thing is making the diagnosis correctly. So having musculoskeletal trained radiologists that can evaluate the imaging and MRIs and other sophisticated studies with me to help narrow the differential of what this could be. And then having a good pathologist that's aware of these different rare tumors and can make the correct diagnosis so we can treat it correctly. Once that's established, having an ability to surgically remove it, where my role comes in, have ability to treat it medically if we're going to treat it with chemotherapy, and also to add radiation therapy, which would be a radiation oncologist. So a whole different team of players. And even on top of that, within the surgical field, there's a lot of things I can't do by myself surgically. If there are flaps that need to be done, so we'll frequently employ a plastic surgeon to help cover an area where I've removed some tissue. If it's in the abdomen, I'll have a general surgeon, sometimes a urologic surgeon, just depending on the location.
Now, does it manifest itself, from your experience, does this form of cancer manifest itself in any area of your body in particular?
Great question. I mean, most commonly for an extremity, it'd be in your thigh or in your upper arm. But it really can be anywhere in the body. That's one of the unique things of sarcoma. It doesn't discriminate. It doesn't discriminate anywhere in your body. You have skin, muscle, bones, cartilage throughout your body. Your skull, your ribs, not just in your extremities. So it can really be anywhere. It doesn't discriminate based on your age. So you have infants up to geriatric patients, elderly patients. And it doesn't discriminate by race or sex. So men and women are affected equally. All races are affected, and it really affects globally. The stats are about the same. It's a rare form no matter where you are in the world.
Well, you know what? It seems particularly devious in the fact that, I'm thinking about myself. I have bursitis in my shoulder, right? Immediately write it off as bursitis. It's that pain in the shoulder. It's a chronic pain, and it keeps coming. If you're a child, like you were saying, oh, he plays sports, so it's related to sports injury or something like that. Meanwhile, this cancer is doing its best to cause as much damage as it can, hoping you don't catch up to it.
True.
Yeah, right. Wow, that's particularly devious, if you ask me. Now, you started an organization, Sarcoma Strong.
Yes, this was to help increase awareness for sarcoma. Also serve as an advocacy area for patients with sarcoma, and ultimately the goal was to help increase funds for sarcoma research.
Now, you've been involved in this, as you said, for close to 10 years now, right?
Yeah.
And each year there's a run. But you want to know something? I really think that our viewers are best served here by just hearing the word sarcoma. It's a form of cancer, manifests itself, as we've been discussing, in some very devious ways, easily dismissed by, oh, it's this or it could be that. And like we were saying, so if you, a loved one, yourself, your children, anything like that, you recognize that there's some kind of chronic pain going on, right? Take that second look at it. That would be probably
Especially
the best
if there's
advice.
a mass with chronic pain, clearly needs to be evaluated.
Right. Get that checked. And Matt here is one of few doctors in our area. Isn't that correct?
Pretty much the state or even the country. There's only 175 or 200 orthopedic oncologists in the country.
Well, and if you can't think it doesn't, if you don't think it hits home, just think about Matt, who works here. Had that pain in his heel, and before he knew it, that's what it was, and you diagnosed it, and now he's jumping through hoops around here, back there in the control room, right, Matt? Well, Matt, thank you very much for coming in and helping
Thank
us
you.
raise
Appreciate
awareness for this, and happy holidays to you.
Happy holidays.
Good.
Thank you.
To see this interview again, you can head to our website, looktvonline.com.